Hi, good afternoon. I am Asmita Pathak. As a part of assessment 2 requirement, I'm going to record a short video clip. In this video, I will explain the way of doing focused health assessment on a patient named Harry. Harry was brought to the emergency department with the complaint of chest pain. He was looking very pale, yellow, and sweaty at the time of admission. Therefore, without wasting our time, we shifted him towards the resuscitation area. At first, I introduced myself in front of him and then explained the purpose of being there. I was thinking of using PQRST pain assessment tool. In PQRST assessment tool, P stands for position or provoking factors, Q stands for quality of pain, R stands for radiation, S stands for signs and symptoms, T stands for time. To begin the assessment, I asked him what is the location of pain, what provokes the pain, what were you doing when the pain started, what makes it feel better. To this question, he replied, I am experiencing severe pain on my chest and it was radiating in nature. To identify the quality of pain, I asked him characteristics of pain like dull, sharp, pounding, squeezing, cramping, crossing. And to these questions, he answered, I am having sharp and squeezing pain on my chest. In addition, to find radiating nature of the pain, I asked the patient if the pain is at only one place or it is radiating, and he said it is radiating from jaw to the arms. I asked the patient to score the pain out of 10 and he replied 8, which denotes that the pain is very severe. He even said that I am having nausea, excessive sweating and cold. Similarly, I asked him regarding the history, onset, frequency, duration, and then characteristic of pain. He said I never had a past experience of pain before, but he said that his family members had the experience of pain and history of cardiovascular disease. I became curious and asked him to explain him regarding his family history. He said that his father died at the age of 40 because of heart attack. His mother recently passed away because of stroke, and his last remaining uncle had a cardiac surgery because of heart attack. I asked him about his work history, and then he replied he is working on a high stress management area. Further, I asked him regarding any disease condition, and he said he doesn't have any disease condition like diabetes. But he said that when he had a flu-like symptoms a week before, he went to the GP and then GP took his blood pressure. It was quite high, that is 174 by 100 mm of Hg. And also his blood pathology was done that time, and it shows that the cholesterol level was quite high. At this point of time, I was suspecting a case of acute myocardial infarction. Therefore, to do the further cardiovascular assessment, I asked permission from the patient. Then I started from the vital signs. All the temperature, pulse, respiration were normal except the blood pressure. Blood pressure was 172 by 100 mm of Hg. Then I moved towards the general body assessment and cardiovascular assessment. I moved to inspection first. On inspection, I checked the mucous membrane for dryness, for sinuses, and also nasal flaring, clubbing of fingernails, pallorness of the body, confusion, and visible pulsation. All the things were normal except the body, because the body was quite pale in color. Then I moved to palpation. On palpation, I found that he was having pain and tenderness on his chest area. After that, I did bilateral movement of the chest and it was normal. Also, I palpated for the capillary refill, and it was found that it was quite delayed for the capillary, for the it was quite delayed than the normal time. On auscultation, I used the stethoscope to check any abnormalities of the heart. I checked for heart sound, B1 and B2 sound, and also the cardiac murmur, but there was no cardiac murmurs. In addition, I performed percussion. There was no any accumulation of fluid in the chest. There was no abnormalities on my patient. This is all about history collection and focused health assessment that I have done on my patient, focusing on his symptoms. This helped me to form nursing diagnosis to plan for the effective and person-centered care of the patient. This will ultimately help the patient to manage the disease condition. Thank you.